One of the really scary things about plastic surgery is the scars. Now, unfortunately, I'm not a wizard. I can't do your surgery without leaving a scar. And plastic surgeons are specially trained to try to disguise scars, to put them in places where they'll be the least noticeable, but everyone will have a scar. You will be able to see it. And unfortunately, everybody's skin heals differently, and some people make more scar than others. So, what's the best thing to do for your scars? Almost everyone I see asks me this question, and the first thing you need to understand is, how do scars heal? So, during surgery, you'll have an incision. I close it very carefully so everything lines up well. And hopefully you won't have any problems with healing or infection or anything like that. Assuming that everything's healing, for the first 6 to 8 weeks, your scar will actually get stronger, thicker, and also more red. And that is normal. That's just your body making new tissue. And kind of at that 6 to 8 week mark, it does reach its maximum strength, but also its maximum thickness and redness. So expect that to happen. And then after that time point, your body will gradually remodel the scar over about the next year so that it does become softer, whiter, or browner, and less noticeable. So the things that you can do to help that process along, there's only a couple of things that have been scientifically proven to help. So number one is keep it out of the sun. If it's in an area that gets sun, you want to keep it covered as much as possible. And ideally, for the first couple weeks, you'll be doing that with the tapes or the steri strips that I've put on there. And then after that, you're going to want to use a really good sunscreen. And even if it's other places that are less noticeable, again, just make sure that you're keeping it out of the sun. Sun can go through your bathing suit or your clothes. So for the first year, just be super extra careful with sun exposure. So that's number one that you can do. And then the only other thing that really has been shown to help with scars is silicone treatment. And so that's the other thing that I recommend too. And there's a lot of different products out there. The one that we have in our office is called BioCorneum. I like this one a lot. I've used it on myself and my kids. And it's really easy. You just put it on twice a day, minimum for 3 months, and it's got that sunscreen already built right in there, so you can just forget about it. But there are other products. If you want to order something less expensive, I recommend a silicone tape. It's called Mepitac, M-E-P-I-T-A-C. You can order that on Amazon, and it also works. The only thing is you really have to keep it on there 24/7, again, for that 3 months. If you don't need sunscreen in your scar cream, there's another one that I also recommend. It's called Kelocote. It's K-E-L-O-C-O-T-E. Also, you can get that right on Amazon. And it's silicone cream, so twice a day for 3 months, and it doesn't have the sunscreen included. So those are the tried and true recommended things that I recommend for scar management. Other things like Mederma, vitamin E, cocoa butter, you're welcome to do those. They don't have any evidence, but as long as you don't get allergic to them, probably doesn't hurt either. And the only thing is, before you start any of those treatments, just make sure that your incisions are totally healed and don't have any scabs on them. And then, especially if you're using the cream, it helps to just do a little scar massage, again, while you're using that cream twice a day. So those are my tips to the best scars. If you do have a concern about a scar, like it's getting really thick and lumpy, kind of raised up, then that's something that you should come into the office for, because a lot of times we can do an in-office injection to help those scars heal better. But if it's just flat, red, the sunscreen, silicone, massage are the tips to having the best scar you can.